यार हाँ, तुम लोग जो भी संडे मंडे को नहीं आ रहे हैं, अगर तुम पंच नहीं कर रहे हो तो तुम्हारी एब्सेंट ही मार ये लाइट्स तो नहीं। ये वेला क्या यूएस का है क्या? हाँ, पेपर नहीं कहाँ से है?
यूनिट टू एक्सचेंज
वैसे ही निकल गया होगा यूएस से ही होगा। इंडियन दवाई का डालेगा ना हम कंपनी का।
Good morning, everyone. Myself Manjeet. My moderator is Dr. Anusa. I discuss the topic Cariprazine. Introduction. It is a typical antipsychotic drug. This drug has low risk of sedation, extra pyramidal symptom, prolactin elevation, and metabolic symptom. History. Developed by Gadon Rizza. US FDA approved this on September 17, 2015 for schizophrenia, bipolar 1 manic or mixed state. In 2019, approved for bipolar 1 depression.
मतलब जो आई होता है वो होता है जी।
Pharmacodynamics. Cariprazine is a D2, D3, 5-HT1A partial agonist. Cariprazine is a potent 5-HT1 partial agonist, has a lesser 5-HT2A antagonism and exhibits low incidence of the drug-induced Parkinson. Cariprazine has a very long-lasting active metabolite, DCAR and DDCAR, with novel and interesting potential for development as a weekly for bi-weekly or even monthly oral dip. Both 5-HT1 and alpha-1 and alpha-2 actions suggest antidepressant efficacy, but it has a potent D3 partial agonist action that are perhaps the most distinguished and novel pharmacological characteristics. D3 partial agonism, cognition, mood, emotion, and reward, substance abuse, as well as negative symptoms. Low activity of 5-HT2C receptor. Drug interaction. CYP453A4 inhibitor, clarithromycin isoniazid, affecting patient on a stable dose of cariprazine, then reduce the current dose of cariprazine by half. Concomitant use of cariprazine and CYP453A4 inducer is not recommended. Metabolized by CYP453A into two long-lasting active metabolites. Based on time reached steady state, half-life of cariprazine is 2 to 4 days, and for one of its active metabolites, ridase methyl cariprazine is 1 to 3 weeks. Indication: FDA approved in schizophrenia, acute and maintenance phase, in acute mania and mixed mania, bipolar depression. Non-FDA usage. Bipolar in bipolar depressive episode with mixed feature, subsyndromic manic symptom, bipolar maintenance in major depressive episode with mixed feature, subsyndromal manic symptom in manic symptom with mixed feature, subsyndromal depressive symptom, other psychotic disorder and negative symptom of schizophrenia. In treatment resistance depression, in augmentation of the other antidepressant in major depressive disorder. Behavioral disturbance in dementia, behavioral disturbance in children and adults. Disorder associated with problem with impulse and post-traumatic stress disorder. Contraindication in non-hypersensitivity. Baseline investigation. Before starting any antitypical antipsychotic, wait, wait all patient and track BMI during treatment. Get baseline personal and family history of diabetes, obesity, and dyslipidemia, hypertension, and cardiovascular disease. Dosing and formulation. Dose. In schizophrenia, 1.5 to 6 milligram once a daily. In bipolar mania, 3 to 6 milligram once a daily. In bipolar depression, 1.5 to 3 milligram once a daily. Dosage form. In capsule form 1.5 milligram, 3 milligram, and 4.5 and 6 milligram. Monitoring. Monitoring after starting and any typical antipsychotic BMI monthly for 3 months. Then ordinarily consider monitoring fasting triglyceride monthly for several months in patient at high risk of metabolic complication and when initiating or switching antipsychotic. Blood pressure, fasting plasma glucose, fasting lipid within 3 months and then annually, but earlier than more frequent for patients with the diabetes or who have gained more than 5% of initial weight. So patients should be monitored periodically for the development of the abnormal movement of the tardive dyskinesia using neurological exam and the abnormal involuntary movement. Adverse effect. Akathisia drug-induced Parkinsonism, restlessness and gastrointestinal distress, sedation, tardive dyskinesia, reduce risk compared to conventional antipsychotic. Risk of potential irreversible involuntary dyskinetic movement may be increased with the cumulative dose and treatment duration. Side effect may theoretically appear several weeks after initiating cariprazine because the plasma level and major active metabolite accumulate over time. Special population in pregnancy. Control study have not been conducted in pregnant women. Teratogenic in rat, not in rabbit. Risk benefit analysis. And these are my reference.
Good morning. My name is Saloni Gupta and my moderator is Dr. Abhishek. We are going to discuss on the topic PET scan in psychiatry. Positron emission tomography permits the study of human brain function with a positron labeled tracer and a model for quantitation. PET scan can determine regional brain metabolism and neurotransmitter characteristics. Schizophrenia is most extensively studied psychiatric disorder in PET scan. Principles of PET scan. PET scan facilitates the assessment of first, cerebral metabolic activity, and second, blood flow. It identifies the activation of dopaminergic pathways using specific tracers and neurotransmitter receptor function. These tracers emit positrons that interact with nearby electrons, producing gamma photons that are detected by scintillation crystals in the scanner, and this produces an image of tracer uptake. How PET scan helps in psychiatric disorder therapeutically, but blood flow, metabolism, and structural imaging studies suggest altered neuronal circuits in major psychiatric disorders like mood disorders, schizophrenia, OCD, and neuroreceptor mapping studies have identified serotonergic abnormalities in mood disorders and dopaminergic abnormalities in schizophrenia. PET scan can play an important role in quantifying the relationship between receptor occupancy, drug blood levels, oral dose, and therapeutic output. In that way, PET scanning can contribute to both therapeutic and to drug development by more rapid identification of likely therapeutic dose range compared with conventional parallel group dose comparisons or dose ranging studies. How PET scan helps in diagnosis of psychiatric disorders. PET scan is a functional neuroimaging tool. In recent years, it has been used to determine the distribution of important neurotransmitters in the human brain. Compared with other functional imaging techniques, PET scan enables changes in the distribution of tracer activity to be assessed qualitatively and quantitatively. In contrast, functional MRI is noisy and leads to signal distortion from nearby tissues, affecting quantitative assessment. PET scan has therefore been used to gain insight into neurochemical pathways. And these are the regions. The red region indicates very high activity of dopaminergic receptors. Yellow region, high activity. Green region, medium activity. Blue region, low activity. And the darker region, no activity. These are the different regions of brain. PET scan imaging in schizophrenic brain is somehow like this. The positive symptoms are considered to be a result of increased subcortical release of dopamine, causing greater stimulation of D2 receptors. Therefore, the primary target of many antipsychotic drugs is antagonism at striatal D2 receptors. PET scan findings in OCD is somehow like this. A PET scan of the brain of a person with obsessive compulsive disease. The high metabolic activity, the red region, is in the frontal lobe areas, which are involved with directing attention. These are PET scans in different psychiatric disorders. This is the normal brain, then depression brain, bipolar brain, schizophrenic brain, and OCD. Thank you. And these are my sources.
Good morning, everyone. My name is Sakshi Gupta. My moderator name is Dr. Mankaran Vas, and my topic is Lesmiditane. Okay. This is the overview. Introduction. According to the global burden of disease, migraine is the second leading cause of the yearly lived with disability, which is known as DELI, among non-fatal disease. Migraine more prevalent in women, 18%, than in men, which is 6%. Most patients use unspecific medication like NSAIDs for the treatment of the acute migraine headache, and who do not get benefit from these from this NSAIDs, triptans are used as an alternative. Drug therapy of migraine. Migraine drug therapy is depends on the type. It's like mild, moderate, and severe. In mild, we use for NSAIDs. For moderate, we can add triptans along with it. And for severe, we use triptans. For prophylaxis, we use beta blocker, which is non-selective beta blocker, propranolol. We use TCA, we use valproate, and other drugs. Lesmiditane. Lesmiditane is a highly selective 5-HT1F receptor agonist. These receptors express on the presynaptic surface of central and peripheral trigeminal sensory neuron. Its activation does not lead to vasoconstriction, unlike triptans. These properties render the receptor an ideal target for new migraine acute treatment. Mechanism of action. CGRP, which is calcitonin gene-related peptide, is transmitter of clinical importance in migraine pathophysiology. Triptans bind to 5-HT1B and D, thereby reduce CGRP release, but it causes vasoconstriction. On the other hand, lesmiditane used as a, it also blocks the release of the CGRP, but it does not cause vasoconstriction. Clinical trials. There are 3 clinical trials. Name is Samurai. First, Samurai. Samurai is a prospective randomized double-blind placebo-controlled parallel group study. Analyzes the efficacy of 2 doses of lesmiditane versus the placebo on use of single attack of migraine. States that the percentage of the patient achieving headache-free freedom at 2 hours after the first dose was statistically significant when compared to placebo. Spartan study. Spartan study was based on the similar design, but here 3 doses were used, and the outcome was similar. Gladiator study. It is an ongoing open label phase 3 trial to evaluate the safety and the efficacy of the long-term intermittent use of lesmiditane for the acute treatment of migraine. Eligible patient from the above mentioned study was enrolled and will be treated over a 1-year period. And this study states that lesmiditane is a well-tolerated and safe. What are the adverse effects? Dizziness is the most common adverse dose-related side effect reported. Others are paresthesia, nausea, and fatigue. Role of lesmiditane in cluster headache. The idea is based on the release of the CGRP in acute CH attack. Patient with cluster headache present with increased risk of cardiovascular disease. Drugs such as triptans abort CGRP release, but it causes vasoconstriction, hence ischemic heart disease and hypertension. Whereas lesmiditane do not cause vasoconstriction, hence it is most preferred than triptans. What are the summary? Lesmiditane are highly selective 5-HT1F agonist in the first drug of its class and lacking tryptin-like vasoactive property. FDA has recently approved lesmiditane for the acute treatment of migraine in adult based on positive result of 2 phase 3 trials, which shows the significant difference to placebo in the proportion of a patient achieving total migraine freedom within 2 hours. These are my reference. This is my reference. Thank you.